If you are over 60, what I'm about to tell you could change the way you think about surgery forever. Because there are certain procedures that carry a much higher risk at your age, not because surgery itself is bad, but because your body responds differently after 60, and most people only realize this when it's already too late. Now here's what doctors are seeing more and more. Adults over 60 going into complex surgeries believing the outcome will be the same as it would have been 20 years earlier. But the reality is very different, and understanding that difference could protect you or someone you love. The first high-risk procedure is coronary artery bypass grafting, commonly known as open-heart surgery. While it can be life-saving, it places enormous stress on the heart, lungs, and brain during recovery, especially in older adults where healing is slower and complications like memory issues or infections are more common. The second is spinal fusion surgery, particularly multi-level or aggressive fusion, which can significantly limit mobility and lead to long recovery times. And in seniors, it often increases the risk of falls and loss of independence. The third is major cancer surgery like the Whipple procedure, one of the most complex abdominal operations, requiring hours in surgery and a very demanding recovery that the body after 60 may struggle to handle. The fourth is elective joint replacement in someone who is already medically fragile. Even procedures like knee or hip replacements can become high risk when the patient has underlying conditions like heart disease, diabetes, or poor mobility. And the fifth, and often the most dangerous, is emergency abdominal surgery, where there is no time to prepare the body, and the stress response can overwhelm already weakened systems. Now here is what most people do not realize. The real risk is not just the surgery itself, but how well your body is prepared before it happens and how it recovers after. And this is where you have more control than you think. If this information is opening your eyes, take a second right now and subscribe, because understanding these risks early can change outcomes later. Now here is what you can do starting today. If surgery is being considered, ask one simple but powerful question. What is my personal risk based on my age and condition? Not just the general success rate. The second is preparation, improving nutrition, physical strength, and managing chronic conditions before surgery can significantly improve recovery. Even small changes in activity and protein intake can make a measurable difference. And third, always ask if there are less invasive alternatives or if the surgery can be delayed safely to allow your body to get stronger first. Because after 60, preparation is not optional. It is part of the treatment itself. You do not need to fear surgery, but you do need to understand it. Because the difference between a difficult recovery and a successful one often begins long before you enter the operating room. And the people who do best are not the ones who rush in. They are the ones who prepare, pay attention, and make informed decisions before it's too late. Before you go, remember this. Your body is not weaker. It is simply different. And when you respect that difference, you give yourself the best possible chance to heal, recover, and stay independent for years to come.